In Uganda, adolescent girls and young women aged 15 to 25 years account for 20% of the new HIV infections. Recent research by Makerere University on HIV risk and factors associated with the use of novel prevention among female students at Makerere University found an increase in HIV infection among young girls.
Of all new HIV infections among adolescents, 93% were among adolescent girls. Of all new HIV infections among young people, 78% are among the girls, the young women. So we notice that there is a prevention gap, and so we have so many questions that are supposed to address the prevention needs for girls.
It is against this backdrop that researchers from Makerere University under Makrif, funded by the government of Uganda, conducted a study to know the percentage of female students at the risk of HIV and also know the characteristics of the students that have used the newer HIV prevention methods such as HIV self-testing, prophylaxis and post-exposure prophylaxis. Ivan Segawa, the lead researcher, noted that prior studies reported that up to 1/3 of the female university students had sexually transmitted infections, and many students engaged in high-risk sexual behaviors, which increases their HIV vulnerability.
Found that at least 1 in 5 of the young women at the university at high risk for HIV, and very few are using these HIV medicines to prevent HIV, despite some of them have been being exposed to HIV. Also, not all know their HIV status, and we hoped that the HIV self-test kits will be able to increase the number of young women who know their status. So we're happy to share the findings with the stakeholders to forge ways forward.
The head of HIV prevention at Uganda AIDS Commission, Dan Byamukama, notes that based on the tools and service delivery model currently developed in the country might fall in ending HIV/AIDS by 2030.
Focused on those gaps, we developed a research agenda. So we are calling upon all researchers in the country to know that the research questions, the unanswered questions in our journey to ending AIDS by 2030 are all compiled. So you should not waste energy, waste resources, researching questions or trying to answer problems whose solutions we already know.
Zahara Abigaba, UBC News.